Now we go to the updates on face-to-face classes and vaccination and others. I call on Mrs. Secretary Leonor Briones to do the reporting.
Mr. President, a while ago, some of us who were waiting here had a
Now we go to the updates on face-to-face classes and vaccination and others. I call on Mrs. Secretary Leonor Briones to do the reporting.
Mr. President, a while ago, some of us who were waiting here had a small discussion also on the issues, and so I will limit myself in the interest of time to just one slide, Mr. President.
Yes, ma'am.
So I would like to show the third slide, the one after. Next, that one. Update, no, back to that one. Updates on the face-to-face classes. Right now, Mr. President, we have 25,668 public schools which are already conducting face-to-face classes. This is 56.89% of the total number of public schools. So more than one half na tayo. On the other hand, and this is a challenge to us, Mr. President, is that there are 676 private schools ang nag-open ng face-to-face. It is ironic that at the height of the debates on face-to-face schooling, there were many loud demands for face-to-face, but now that you have approved it, ang private schools have only 676 private schools opening face-to-face. So ngayon, na yung face-to-face, more than 50% sa public schools, pero sa private schools, 5.47% lamang. So ito yung challenge. All in all, that makes 26,344 schools. Ngayon, in terms of learners naman, mga estudyante, ang nai-involve sa public schools, Mr. President, na face-to-face na, kumbaga as I always joke, face-to-face na sila, ay 5,948,640 learners na, more than 5 million na. And sa private schools naman, ang nanggagaling ay 226,991 learners. So at present, Mr. President, we have 6,175,631 learners na nag-face-to-face. More than one half na. And at the rate that learners are enrolling, especially in the private school, we are confident and we're targeting, and this is a suggested target of Secretary Duque, if we can reach 75%, that would already be acceptable. The challenge, Mr. President, is yung private schools. Kasi makita natin na out of about 16,000 private schools, you only have 676 private schools which are now on face-to-face, in spite of the fact that they were quite active in demanding face-to-face. Secretary Vince, a while ago, talked to the private schools, and he can share with you the possible reasons why they are not actively opening their schools together with Secretary Duque. And perhaps this is the challenge right now. Walang problema sa public schools kasi the minute ma-assess ang isang region or isang place na level 1 or 2, automatic yan, face-to-face ka agad. Pero ang sa private schools, of course, decisions nila yun. And so we are now aggressively endeavoring to convince them to open at this time because 16,000 sila. This is only 5%, Mr. President, compared to sa public, 56%. Tapos all in all, Mr. President, lahat na teachers natin, na 947,000 ang ating staff, etc. 93% na ang level ng full vaccination. So, halos lahat ng staff natin sa DepEd ay fully vaccinated na with this kind of numbers. Thank you, Mr. President, and perhaps Vince and Secretary Duque can join the conversation.
With the permission of Secretary Briones and Secretary Duque, Mr. President, Secretary Briones is correct. Right now, the challenge is really to convince the private schools to already engage in face-to-face. However, as articulated by the Secretary of Education, there is some resistance from the private schools, no? And upon some consultation conducted earlier this evening, it seems that it is a mix of various reasons, and the most compelling of which is that some parents in the private schools are still quite apprehensive about letting their children go back to face-to-face classes, no? Which of course is the right of every parent, Mr. President. However, I think government, in service of the greater public good, I think we discussed that maybe it is good for the IATF, of which DepEd is a member, to issue a resolution strongly encouraging private schools to go back to face-to-face as soon as possible. No? Although we acknowledge that there are various modes right now being employed, such as blended learning or complete online learning. We feel, the Department of Education feels that, supported by the Department of Health, that it is time to already go back to face-to-face classes. And the IATF, I think, in its next meeting, most likely, as guided by our chairman, will issue such a strong endorsement or strong encouragement for private schools in particular to go back to face-to-face classes. Sa public school naman po kasi, Mr. President, as clearly we are already on track, no, to reach that. We are already at 60% nationwide, and this will just keep on growing in the next few months. Anyway, Mr. President, the school year is about to end in a month, if I'm not mistaken, and the new school year will start in August, no, for most schools. So siguro po we can push that, and obviously the next administration will take over in about 2 months' time, and hopefully will continue with that push for face-to-face classes upon the resumption of the new school year in August. Thank you, Mr. President.
Mr. President, if I may also manifest. Remember in our last Talk to the People meeting in Davao last week, you very clearly stated that you would like that the students already begin to attend school or face-to-face classes, but with the condition that you said, during that time, magpa-injection na doon ng kanilang vaccine, which is a very, very good suggestion, Mr. President. And so we have already articulated this to Secretary Briones so that we can ramp up the relatively low vaccine coverage for the students in the basic education sector. So, yun po, gagawin natin, sir, pagka umattend sila, parang yung dati, nung mga bata tayo, niksyon na tayo ng mga kanilang infirmary ng mga iba't ibang bakuna, like measles, yung sa polio. So, gagawin din natin to for COVID for the basic learners from 5 to 11 years of age, Mr. President. Yun lang po.
Thank you.
Mr. President, just to add lang po very quickly, Secretary Galvez, in fact, has already given the instruction to make the vaccines available for all the schools. No, meaning we have the supply, we have about 15 million doses for the vaccines for pediatrics for 5 to 11 are already in country. We have about remaining about 10 million doses in stock. So we have the vaccines po, and these can be easily deployed to all our schools for our children.
You know, in Okta research, in his survey nila, 83% of the entire Filipino people gave us a whopping 83% of them believed in the soundness of the vaccine program. And to get that number is good enough to make us happy. 82% is a high percentage. Well, may itanong lang ako sa iyo, why do these broadsheets, itong newspaper ba, the broadsheets, itong national, bakit mayroong isa doon, I had a late breakfast kanina, nabasa ko, hindi agad ako nakinig sa balita diretso ako sa newspaper. Bakit naka-banner pa rin yung headline na surge somewhere? May isang newspaper ngayon, I forgot. Mayroon pa rin silang, why do they have to really come up with something that is not alarming but almost a source of irritation for all of us, when as a matter of fact, we have at least the accurate. Bakit hindi sila magtanong sa, I'll give you a call tomorrow. I will review the newspaper. May isa naka-banner talaga.
Sir, nakita ko rin yun, sir. Sabi, magkakaroon ng surge possibly after election.
No, ganon.
But qualified naman, sir, if the minimum public health standards are violated, are not complied with, they project that there will be a surge. Although in the qualifying subsequent statement, it's very clear, no, na hindi naman yan absolute talaga magkaka-surge. But kung hindi susunod ng tao, in fact, the faster modeling group has projected that if the reduction in the minimum compliance to the minimum public health standards, yung 30% reduction, will be equivalent to 300,000 active cases by the end of May this month. So it is also a good reminder, although it is sometimes a source of irritation for us, but it is also good because people are told that if you're careless, if you are reckless with your compliance with the wearing of the mask, you're going to get sick. You're going to be hit by these evolving or emerging subvariants of Omicron. Ang problema natin dito, the biggest challenge here, Mr. President, is the virus is so unpredictable. You do not know which bend it's going to turn. So,
It will turn the stronger one.
Hopefully, hindi naman sana stronger.
Mutants
Nag-mutate po siya. But the WHO has not recognized them as variants of interest nor as variants of concern. They still are treated as Omicron variant. And luckily, we've had a surge with BA2.2 in January. Predominantly, that was the variant that caused our spike in January. And hopefully that with our increasing vaccination coverage, we have a much higher level of protection, Mr. President, so that we hope that these low numbers are sustained and we will not see any overwhelming of our health system's capacity. Which at the end of the day, Mr. President, kahit na tumaas, wag po tayo masyadong mag-worry kahit na sumipa ang mga kaso, basta yung hospitalization rate mababa, sir. Okay tayo, sir.
Thank you.
Maraming salamat. At kung ikaw ay interesado ng mga bidyong tulad nito, mangyaring suportahan ang channel na ito sa pamamagitan ng pagpindot ng like, pag-share ng mga video at kung bago ka pa lang sa channel na ito, please subscribe sa channel na ito at pindutin ang notification bell at piliin ang all upang maabisuhan ka para sa mga paparating pang mga videos.